on the proposal has gone through C3PH and their cadre of lawyers. And so the question of age discrimination has been answered by that cadre of lawyers. And the stuff we have there in blue really has met the test of this would be difficult to sue about. So the things you gotta worry about in your own facility is the physical exam being done by somebody's relative and just written off, or being done by somebody that the hospital has got picked, selected, chosen, because they want to get rid of an aging physician. And we eliminate that in the Haskins proposal by making the physicians select from a list of physicians that are enrolled in this group that can do physical exams. If at the end of that, there's an answer of we need more, it's the wellness committee that coordinates the more. And generally the more is going to be neuro-behavioral assessment. It might be so much as you need to get down to PACE or an equivalent group like PACE and have a thorough assessment of your needs. Now that costs anywhere from $8,000 to $10,000. That part would be borne by the physician. So the initial assessment, the micro-cog, which is a couple $100, the physical exam, which is around $100, the hospital would pay for that. For its currently, Mercy Folsom has 37 doctors that are 65 and over this year. So the hospital would bear that responsibility. But if the wellness committee gets a report from that doc that says they need more in order to practice these credentials, that would be borne by the physician if they want to keep their credentials. The second assessment would be done at age 70 and every 2 years thereafter as they ask for privileging. I talked about the physical exam, right? Okay. And the wellness committee is the one who coordinates this, not the credentials committee and not the medical exec committee. But the wellness committee coordinates the initial gathering of information, meeting with the doctor asking for privileges, and deciding does something else need to be done in order to meet these privileges. You'll see the micro-cog test, next, looks at 9 different areas of cognition. If somebody fails, meaning they're less than 1 percentile, compared to age-related, age-matched individuals, then they need to go to the further step. That further step might be PACE or it might be something else, depending on what privileges they're requesting, right? So, and that's their loss of function of more than 1 standard deviation below the norm, which is actually kind of hard to do. You really need help if you fall below that 1 standard deviation. The report is a yay or nay. This physician can or cannot perform the privileges that have been requested. If the wellness committee says you really can't do this, then there's lots of options for that. Talk to the department head, talk to the physician himself, have a realignment of what privileges they're asking for. If it comes to a physician who says, no, I'm not working with you, that's where it gets to the medical exec committee. If it comes to, no, I'm not going to follow the recommendations that have been made as I've been evaluated, that's where it ends up in the medical exec committee. And that's what people are fearful of, because that gets a report to the Medical Board of California. If your privileges are revoked or suspended, if there hasn't been a mediation occur with the wellness committee ahead of this, that's where a Medical Board of California report. And if such a thing happens, there is part of standard bylaws of medical organizations, a hearing can be undertaken, and all of that is expensive. And most physicians who undergo this either restrict their credentials or retire. It works. There are immediate things that can be done if a physician is found not to be able to withhold their credentials. They can modify what credentials they're asking to do, the privileges they're asking to do, and that's what most of them are doing, is they're saying, forget it, I just won't go in the operating room, I'll just do the non-procedural things. They can reduce their panel, they can reduce their work hours, they can operate only with specifically trained assistants, or have all of their work, if they're in the clinic, all of their work reviewed by a peer. These are things that the wellness committee can coordinate so as to avoid a report to the medical board. And then you get to a point where the doc says, I don't want to do any of that. I just want to step back. Now what am I going to do? And with physicians, this is really their livelihood. It defines their life. It's their value. It's their worth. And so I think the wellness committee really owes it to the aging physician who doesn't make it through this process to say, let us help you to decide what you're going to do with the rest of your life. And that's what the next 3 slides are. It's amazing how much physicians can do outside of their the work they've been doing all their life that they haven't even considered. And it's up to the wellness committee to have a serious discussion with a physician who meets those criteria to say, let's talk about what color is your umbrella. Pharmaceutical field, drug rep, research, development, medical device consultants. It is the physicians who put in 50 years in practice who are the most expert and can provide the most for these groups. In the insurance industry, wouldn't you like to be getting prior authorization from a real physician and not somebody following the script? Healthcare consultant in the world of public health, a crowd doctor. I didn't even know there was such a thing. The doctors who manage marathons or manage concerts, the team doctors, the occupational physician, hospital leadership, administrative, being a chief wellness officer would be an alternative to practicing medicine. Run for public office. Just saying. There's probably a reason that I'll be down there for office. Teaching is an exceptional way to end your career on a positive note, whether it's teaching other medical students or teaching at nurse practitioners or PAs. Writing out the CME questions, going on the road with public speaking, virtual medicine. There's many, many volunteer opportunities, both abroad and here. Writing your books, writing about medicine, writing about wellness, becoming a radio or TV personality. Forensic medical examiners could be retired physicians. Inventors, all the things that you wish you had when you were a practicing physician, you can make. Becoming an expert witness. Turning your life over to the artist, whether it's music or medium art that you've always wanted to do, or simply retire, relax, live it up, and enjoy. Those are all the alternatives that should be explored by the wellness committee with the physicians who don't get through that the testing that I'm recommending. Healthy doctors make healthy patients. We want to make sure the workforce stays healthy. We want to make sure that the people at the end of their life of giving don't give up their life because they feel it's the end. The end.